Hi, I'm Ted Kruse with Physical Therapy Solutions, and today we're going to talk about the shoulder and the rotator cuff, injuries that can happen, and also how we can take care of an injury both conservatively or surgically. The rotator cuff is a commonly injured part of the shoulder, the most common injury that we see in physical therapy. Last week we reviewed the anatomy, going over each of the four different rotator cuff muscles that we talked last week. So supraspinatus, the subscapularis, and then on the back side of the shoulder, the infraspinatus and the teres muscle group. To diagnose a rotator cuff injury can be done by a family physician, sometimes an orthopedic physician. Oftentimes we'll see people that are complaining of shoulder pain and may diagnose or get that ball rolling to know if there is a rotator cuff tear. The first thing we're going to look at or try to figure out is if it's a major tear, a full thickness tear, or a partial thickness tear. To completely diagnose that would require an MRI. So if we're seeing somebody in physical therapy and they're not progressing the way we would expect, we'll definitely consult with the physician, maybe an orthopedic physician, so that they can order an MRI to have that diagnosis. Oftentimes, if a tear is a partial thickness tear, we can treat it conservatively with physical therapy. Some of the common things we're going to work on in therapy are first and foremost range of motion, to make sure that that shoulder is fully moving through a full range of motion, and most importantly, a functional range of motion. Our job as a therapist is to get you, the patient, functional or using that arm again. So we start with range of motion, and then we'll progress to strength, again, in a functional way that you can use your shoulder and live out your normal daily life the way you would like to. If the shoulder isn't progressing the way we would expect, or we are suspect of a full thickness tear, we'll often then consult with an orthopedic doctor if they have not been involved to this point. They can take an MRI, do a full workup, and judge the severity of that tear, and oftentimes then if it needs to be surgically repaired. So at that point it'll be out of our hands and the repair will take place. The repairs depend on the severity, and the surgical intervention will dictate the outcomes coming forward or where we can progress. A lot of patients will question when they're going to start therapy, if they're going to start within a week or two after surgery. Sometimes they'll wait to 3 to 4 weeks, and that is dependent on the physician. It's dependent on the severity of the tear and exactly what they had to do in surgery. So we'll always defer to the surgeon. They were the ones in there working on that shoulder, and they know what needs to be done in a timely way afterwards. Early on, the repair is weak and susceptible to re-injury, so we need to be sure that we're not stressing that repair until enough time has elapsed to where the repair has scarred down and healed, and then we can put appropriate measures or stresses through that tear. After about 4 to 6 weeks, we'll slowly progress, adding in active range of motion and strengthening activities until we get that patient again functional and able to use that arm. Rehab time can take anywhere from 3 to 4 months, again depending on the severity of the tear and the surgery that was required. If you have more questions on rotator cuff tears, surgeries, and the rehab after, please feel free to contact us at Physical Therapy Solutions in Dyersville or Manchester. Thank you.